main challenge in the e-health today is to handle the complexity. Yeah, and when you approach the administrative level and you go with complex solutions, it's not possible to get the needed support. So we need to really understand simple steps to make these things available and accessible to the politicians. When it comes to generalizing semantic interoperability, there's a huge barrier around the complexity. So we need to understand, it's clear that building the infrastructure is part of the e-health infrastructure. It's also clear that semantic interoperability, it's very much an international affair. And where the challenge is to link the European, the international level to the national level. And I think we've done major steps in the technical standards. It's very clear how we can go from HL7 standards, from IHC specs, down to the national level, localize, somehow maintain the relevance, the processes there. We're still a little bit far from being there when it comes to semantic interoperability. So talking about the Greek situation, what I feel we're ready to address at the moment is localization of standards, so translations, maybe transcodings. But I cannot see how we can maintain assets that are built at an international level, which if we commit to use them for national projects, there is a clear risk that these assets will not be maintained by anybody. And I think in this particular area, we need to take action, and we need to think who and how at the European level would really take care of essential assets which member states do decide collectively to use, for example, for cross-border care. This is not clear at the moment.
My call for action, what I'm getting from the today's meeting is in fact that there is still a need for better understanding the added value of semantic interoperability for the healthcare system, not for the industry, not for clinicians, for the healthcare system in general, and that includes everyone. The industry, that includes the clinicians, that includes the patients and the payers, the health insurers. We need to be able to start from the service, to start from which service or which healthcare process will benefit from this semantic interoperability. And once this is done, then trying to define the cost of the non-interoperability or the cost or the benefit of the interoperability. Very pragmatic. But we need to start from the service, we need to start from use cases where this is happening.
I think actually, for me, the key challenge I see is that people doesn't know what semantic interoperability is and what it means. So that is the biggest thing. The procurers which needs to buy systems don't need how to raise the needs or the demands for semantic because they don't know the impact. Again, the vendors which should implement don't know that much of it. I would definitely like to see both on a national level and also on a European level, an international level, that we try to build on some sort of community or advisory organization where people can go to. So when the ministries of the healthcare region need to go into procurement, they can have a go-to place to be advised on what are the challenges, what should they be aware of, and how can they specify some need. Maybe even say they can point someone local which can support them in these challenges. And also I would like to see the SDOs, the Standard Development Organization, describing the standard. What is the value proposition of these standards? So why should we put them? That would both help the vendor side, but it will also help the procurer of healthcare solutions. We do have many, many good standards. For me, it's we need to implement them, start using them, learn from them, and then adjust them for whatever use cases. I don't see that we need that many new, but we need to put the existing one to a more patient-centered focus, because we are with a new challenge that the patient is also the intro of information, of healthcare information. So we need to support that need as well.